For anybody who's ever sprained their ankle or had a twist to that ankle, it can cause pain right away. You can have swelling, you can have bruising, and difficulty weight bearing at times even, especially right after that injury. From an ankle sprain, you can have this from multiple different injuries. The most common one is going to be an inversion injury where that ankle rolls outwards. And what happens is you end up causing a stretching or tearing of the ligaments that support the lateral bone. This also can cause injuries to the inner ankle as well, and you can have sprains to the inside of the ankle, whether it's an eversion where that ankle then turns outwards, as well as an injury called a high ankle sprain, which is more up into the stabilizing ligaments around both the tibia and fibula, which are the two bones coming down the lower leg. If you sprain your ankle, it's very common to try to treat this conservatively at first at home with ice, elevation, and rest, some compression. Doing all these things have been shown to be somewhat effective in terms of at least calming down those acute inflammatory markers. Ultimately, if you continue to have persistent pain or any difficulty weight bearing or pain when you push on the bone of any aspect of your foot, it's very important to see a medical professional. When you see a physician after having an ankle sprain or ankle injury, we're going to do, again, a good history and physical to make sure we get the story of what was caused. We also want to see how you are ambulating and if you can actually walk on that ankle. Then we're going to do a good evaluation of the ankle and the lower extremity to take a look, do you have bony tenderness or is it all ligamentous? And then also to see the stability of the ankle, because that's going to be ultimately what's important long term in terms of your treatment. We'll be looking at x-rays if it's warranted to see if there's any fractures of these bones or any breaks. And then ultimately kind of putting together a plan, whether that's physical therapy, rehab, or ultimately immobilization is going to be what we're going to be looking to do. In terms of the treatment and length of time you're going to be out of sport, it really depends on how you recover fully. Even when you have a somewhat bigger injury to some of the ligaments around the ankle, we can sometimes rehab this, and as long as the ankle's stable, you can get back to playing sports. Ultimately, they can progress to a point where you will need surgery for reconstruction of some of the ligaments, but a lot of times if we can treat it conservatively and we do things appropriately up front, this can keep you away from that.